Hi again, this is Dr. Habib, and I want to start by saying, what is the definition of treatment? Generally, it means some kind of intervention from a medical entity, whether it's advice, whether it's therapy, hands-on, medication. That's the kind of definition of treatment. But I want to kind of hear from your perspective. And I believe that when patients hear the word treatment, they believe the doctor is actually fixing the problem. So let's challenge that concept real quick. If you're on the blood pressure pill and you stop the blood pressure pill, what happens? If you're on cholesterol pill and the cholesterol pill is stopped, what happens? If you're on the sugar pill and you stop the sugar pill, what happens? So if the answer is those numbers go back up, did you control it? Oftentimes doctors use the word manage. Or did you treat it? Okay, so your definition may be different, but as far as I'm concerned, if I'm going to treat something, I'm going to try to fix it. And luckily, for those common stuff like blood pressure, cholesterol, diabetes, sugar, even arthritis, autoimmune disease, I can fix those. So I can safely say, comfortably, that I like to treat those conditions. And frankly, if I can't fix it, I won't call it treatment. I'll control it. I don't even like the word management. Managing what? Managing is like what the rental agencies do for houses. I'll tell people, honestly, because I'll give you another concept. When people have blood pressure and cholesterol and diabetes, all the common risk factors, say, for a heart attack, and the doctor controls those, manages them, there's only a 25% reduction in heart attack. I mean, does that sound like treatment? Well, it is, because that's the standard of care. That means every doctor is doing that. But that's a pretty low bar. That's a pretty low bar. And I'm here so that I can educate people to raise the bar. And just like I want to redefine the word treatment, I also want to redefine what it is to be a good doctor or how to manage conditions better. So one of the common ones that's very poorly managed is blood pressure. 1 in 3 adults between 40 and 60 have it, of which only half of them are being controlled. So here we are, where a lot of millions of people have a condition, and once we've identified it and we've got them on medicine, we're only controlling it half the time. That's pretty appalling. I joke, I say that, in most businesses, it's all dependent on your outcome and results. And if your outcome and results are as bad as that, you'd go out of business, but not in medicine. It seems like nobody's going out of business. I mean, I'm talking about the healthcare industry. And that's unfortunate because, I'd like to put them out of business. And that's why I'm, educating people that don't expect the low standard, raise the standards. And the only way to do that is you as the public, you as the patient have to demand it, because I'm going to educate you with what the possibilities are out there. So here we are, we're talking about that all these, that we're going to redefine the word treatment. And now I'm going to talk about a couple of conditions which we can fix. And we have to fix it, because the consequences of not fixing it, the consequences of just merely controlling it and managing it are not good, because just like the blood pressure is not well controlled, that's why we have so many complications, why so much heart disease, so many strokes, because you're just managing it. You're not trying to fix it. And so what's common about stomach problems, acid reflux, blood flow, and blood pressure? So particularly for men, it's very easy. As the blood flow to the penis goes down between 20 and 50, for some people who are not taking care of themselves, they may have erection problems at the age of 20 and 25 and 30. But large number of people have erection problems. So they say by the time you're 30% of the population have erectile dysfunction, men. If you're 40% of the male population have erectile dysfunction. By the time you're 50% of the males have erectile dysfunction. Those are bad enough. I mean, it's probably higher than that. Now here, I'm going to give you a solution. Why is the blood flow to the penis going down? And there was the clue that whatever is going on with the stomach has not only something to do with the blood flow in the penis going down, but it's also to do with high blood pressure. So I'm going to fix 3 things right now. First, let me give you the connection. I'll give you the simplified one, and then if we have time, we'll go into more detail. When you don't have acid in your stomach, because so many people are being treated with antacids, with H2 blockers, proton pump inhibitors like Nexium, Prilosec, Protonix, when you don't have acid and you stay on those medicines for a long period of time, we're talking about years, maybe decades, without the acid, you cannot make nitric oxide. Nitric oxide is what makes the blood flow in the penis. So as nitric oxide is going down, the erections are getting weaker. And if people understood that long before high blood pressure is also going up. Because when the blood vessels are not dilated, then as they are less open, they're tighter. The blood pressure starts to go up. So the point is, as acid goes down, nitric oxide goes down, and blood pressure starts to go up. Long before it goes to 130/90, 135/90. That's the cutoff now for treating it. So it's difficult to measure nitric oxide directly. There are complicated ways or experimental ways we can do that. But I gave you the clue. If you're a man, all you've got to do is be cognizant of how the erections are functioning over the decades. You don't have to start at 50. You can start in your 20s and 30s because that's where the problem are. So why is it that people are having stomach problems? They're having stomach problems because of their diet. Actually, it's more simple than that. They're not sleeping enough. They're under more stress. And the point is that oftentimes when the gut is not working well, we call it prokinesis. Things are moving down well. You know, the stools are well formed. The transit time is 12 to 24 hours. The stools are well formed, so you feel satisfied. There's no bloating. There's no sort of irritability. When the gut is not quite perfect, even without symptoms, people are probably going to get some degree of gastroesophageal reflux disorder. By the time you have symptoms, it's probably likely that the gut below hasn't been working well for some time. So as I said, without the acid, you are going to accelerate not only increase in blood pressure, but now we know that without the acid, you cannot absorb minerals and nutrients. As a result, we now know that they can also contribute to blockages, cardiovascular disorders, right? So the stomach is very, very important in this connection, and that the history can give you a lot of data. Now, what are the techniques that we use to measure nitric oxide? So, as I said, if we have a little time, we're going to just go into it a little bit more detail. Now, what happens is the way your arteries open rapidly is a reflection of the release of nitric oxide. It's really a gas, okay? And it's all over the body. It's not just here, today, gone. It's constantly being produced and being used throughout the body. It's used to open up arteries. It's used for detoxification. It's used to support the immune system. In fact, they describe nitric oxide as probably the key parameter that keeps the whole body working, including the mitochondria and energy. So time will tell if that turns out to be true. Now, so what we do in order to, the gold standard for measuring nitric oxide, there are some certain other combinations that are almost as good, but the gold standard is to say, if I put a probe on my fingertip and I use a blood pressure cuff to turn it off, it means raise the blood pressure cuff to above the blood pressure so that there is no blood coming out. When I release that cuff, depending on how rapidly that pulse is felt at the probe will determine the release of nitric oxide. So literally, when you cut off the circulation by raising the cuff pressure to the time when you release it, that interval will determine whether you have adequate nitric oxide. And so for people with good nitric oxide level, the blood flows rapidly and the artery opens up rapidly. For people where the nitric oxide levels are going down, it takes longer. And for some people, they don't have any nitric oxide. Now, let's take that concept for a second, because a significant number of people are asking for what we call we're calling for phosphodiesterase 5 deficiency medication. That's a fancy word for saying Viagra, Levitra, Cialis. Those work on an enzyme to allow the nitric oxide to stay in the system longer. So it's actually not a bad type of medicine. Just incidentally, what it does is increases the blood flow. So nitric oxide makes the blood flow. That's why some of those medications gives headache, because the blood is flowing, because the blood vessels are opening, and that is what gives the headache. So one of the side effects to taking, particularly I think Viagra, is headache, because those medications are designed to slow down the breakdown of nitric oxide, keeping it in the circulation longer, increasing vasodilation. But they can only last for so long, right? The people who rely on those, and without fixing the acid problem, without exercising, without stopping smoking, without healthy lifestyle, at some point those medications stop working, because you can only keep as a substance in the system if there's some of it there. In other words, if you have nitric oxide, you can keep it in the system by stopping it from being broken down. But if there is very little nitric oxide, so little, you can't stop it from breaking down, those medications stop working. As opposed to, why don't you make the right amount of acid? Put the nitrates into your body. Let the body make nitric oxide. Because not only will it increase your blood flow to the penis, it'll lower your blood pressure. It'll increase the circulation in your brain and every organ system in the body. So here we started by saying, what is treatment? Treatment is understanding that long before blood pressure, there is decrease in nitric oxide, which is closely connected to the gut. In fact, everything is connected to the gut. It's too simplistic to say, but all the science is pointing that way. So the treatment is to fix the problem. A good doctor would understand the connection between which came first, the chicken and the egg. And even beyond that, there's nothing stopping the doctor trying to help control both things, right? It depends on the urgency that you have. So there's the connection between nitric oxide, erections, blood flow, and blood pressure. And redefining the treatment means fix the root cause, get the acid going, produce the nitric oxide. Not only will your stomach be happier, you'll prevent high blood pressure.